So what the drugs that I'm interested in are under a group heading called adjuvant endocrine therapy, and they are prescribed for these women who have estrogen receptor positive. And the drugs that you may have heard of are tamoxifen, and the other group is the aromatase inhibitors, and the two I'm going to talk about are anastrozole and letrozole, because they're the ones that are most generally used for early breast cancer, which are the group of women that I've been studying. Now, tamoxifen in particular has been extensively studied in a number of clinical trials. It's been one of the mainstays of treatment in breast cancer for around 3 decades, and one eminent oncologist described it as one of the most important drugs that's been discovered in medical oncology. Now, tamoxifen is important because not only does it reduce the risk of breast cancer coming back, it's also got a role in reducing breast cancer developing in the other breast, so it's got a role in prevention as well as in the treatment. The aromatase inhibitors are kind of the new kids on the block, but they have been shown to be, in some instances, even more effective than tamoxifen among specific groups of women, but over long-term survival, both sets of drugs are pretty similar in the effect that they have. So, with all that good news, why am I standing up here talking about them? Some of you may have attended a Cafe Science a couple of years ago that Dr. Colin McCowan gave about these adjuvant endocrine therapies. And what he had done was he had a database of almost 5,000 women in Tayside collected between 1993 and 2008. And he looked at how well women actually continued with their medication. Now, what I didn't say was that generally these medications are prescribed for 5 years, one a day for 5 years. His research showed that after year 1 there was a drop off of approximately 20%, so 20% of women stopped taking the medication. After year 2 it could be down another 10%, another 10% in year 3, and generally after that it remained quite stable. So that's quite a large group of women who weren't actually taking the medication as prescribed. Now what that means is that what research has shown that in order to be most effective at reducing the risk of breast cancer coming back, these medications have to be taken at least 80% as prescribed, 80% of the time. Missing 1 in 5 can increase the risk of cancer recurring. And his study and other studies, it's not just Colin's work that I'm quoting here, there's actually been quite a number of studies that have shown that between 19 and 28% of women don't actually take the medication or are prone to missing at least 1 out of every 5 doses of medication, thus increasing their risk of breast cancer coming back. So we have to ask ourselves, why is this? Most of the time, if you look at any of these studies, there might be some suggestions. It might be younger women, it might be older women, it might be linked to socioeconomic class, it might be linked to the cost of prescriptions. But one of the things that most studies will suggest is that it's linked to the side effects. And I'm just going to give you an idea of what the side effects are, and you can maybe understand a bit why that's suspected as being the main cause of women not taking the medication. So for tamoxifen, around 45% of women will experience hot flushes or night sweats. 25% will experience extreme fatigue. 1 in 10 will experience vaginal dryness, itching, discharge, and there will be lightheadedness potentially for that number as well. There are rarer side effects which can be very serious, such as thrombosis, which are blood clots, and also womb cancer or endometrial cancer. It can be you can be at increased risk of that by taking tamoxifen. But there are a whole load of other things, such as sort of headaches, swollen joints, nausea, lots of things that can go with taking tamoxifen, as with many other drugs. For aromatase inhibitors, the list of side effects or the severity of side effects is supposedly somewhat lessened, but there is an increased risk in the first few years of heart problems and osteoporosis, which is linked to your bone density, which can be affected by aromatase inhibitors. But the main side effects from these drugs is probably joint pain. Now, that can sound like nothing, but actually, if you've experienced joint pain, that could be very, very difficult to deal with. So both kinds of things, both of the drugs or groups of drugs I'm going to talk about have side effects. So is that the whole story then? Am I just wasting my time doing this work and actually it's just side effects? Well, if we again go back to the clinical trials that have been carried out with these drugs, what we find is that generally with a clinical trial there'll be two drugs sort of compared, but there'll be a long follow-up for these drugs. And the follow-up for tamoxifen and aromatase inhibitors shows us that actually 72 to 78% of the women do carry on and take their medication. So there is a difference between real life and what happens in clinical trials. Women are not taking it as they do in the clinical trials. What is that? It can't just be about the side effects, because presumably they still experience that whether they're in a clinical trial or not. So, just to recap, these drugs are very important at reducing the risk of breast cancer coming back, but there are quite a number of women who find it very difficult to take over the course of 5 years.